What do ground glass opacity and honeycombing mean on a COPD court scan? Imagine looking at a picture of your lungs and seeing some hazy areas alongside some tiny clustered cysts. What do these images tell us about your lung health? Today, we're going to explore what ground glass opacity and honeycombing mean when seen on a court scan in relation to chronic obstructive pulmonary disease. First, let's talk about ground glass opacity. This appears as a hazy, grayish area on the scan where the lung tissue looks slightly cloudy. The key thing is that the blood vessels and airways are still visible through these hazy spots. This suggests that the tiny air sacs in your lungs, called alveoli, might be partially filled with fluid or thickened walls. In COPD, ground glass opacity often points to inflammation, early signs of fibrosis, or partial collapse of alveoli. It can also mean there's some fluid buildup or ongoing injury to the lung tissue. These changes are sometimes reversible, especially if caught early, and they can indicate active inflammation or early stages of scarring. Now, moving to honeycombing. This term describes a pattern of small, cyst-like spaces grouped together, often with well-defined walls. These look like tiny honeycombs on the scan, usually found near the edges of the lungs. Honeycombing is a sign of advanced lung fibrosis, which means normal lung tissue has been replaced by scar tissue. In people with COPD, seeing honeycombing suggests there's more than just emphysema or airway obstruction. It indicates that the lung has undergone significant and irreversible damage, often involving scarring and destruction of lung architecture. Honeycombing is less common in pure COPD but can appear when there's overlap with other lung diseases like interstitial lung disease or severe fibrosis. So, in simple terms, ground glass opacity shows areas where the lung might still be healing or inflamed, and it could be reversible. Honeycombing, on the other hand, shows permanent scarring and damage that can't be undone. Recognizing these patterns helps doctors understand how much damage has occurred and what kind of treatment might be needed. Ground glass opacity might lead to treatments aimed at reducing inflammation, while honeycombing can signal a more serious, advanced stage of lung disease requiring careful management. In the end, seeing these features on a court scan helps doctors get a clearer picture of your lung condition, guiding decisions on treatment and monitoring how your disease progresses.